Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This video is on a recent Lancet article titled Efficacy and Safety of Clopidogrel versus Aspirin Monotherapy in Patients at High Risk of Subsequent Cardiovascular Event after Percutaneous Coronary Intervention, after PCI. It's April 16 today. Long-term antiplatelet therapy strategy post-PCI remains uncertain. Standard practice favors aspirin monotherapy after dual antiplatelet agent based on older data, example a 2009 meta-analysis. Clopidogrel is proposed as an alternative and is supported by ESC 2024 guidelines and the host exam trial. There is a need for large randomized controlled trial in high-risk patients focusing on hard endpoints, death, MI, and stroke to validate clopidogrel's role. The population at risk includes prior MI, diabetes, and complex coronary lesions. The design, it was 26 sites in South Korea, prospective, open-label, randomized, multi-center, 5,506 participants above the age of 19. They completed standard dual antiplatelet therapy and they were high ischemic risk. They were randomized 1-to-1, either to clopidogrel 75 milligrams once a day or aspirin 100 milligrams once a day. The primary endpoint was a composite of all-cause mortality, myocardial infarction or stroke. That is together it's called major adverse cardiovascular and cerebrovascular events. Follow-up period, median 2.3 years. They did exploratory genotyping for CYP2C19 in the clopidogrel group. Results: clopidogrel clinches the win, no strings attached. Major adverse cardiovascular and cerebrovascular events in the clopidogrel group was 4.4%, and with aspirin it was 6.6% with p-value 0.013. Number needed to treat 45. Myocardial infarction 1% in the clopidogrel group versus 2.2% in the aspirin group. There was no difference in the stroke groups. Bleeding was similar. GI events were significantly lower in the clopidogrel group, 2.8% versus 4.9%, hazard ratio 0.65. Conclusion: it's time to rethink our go-to pill. Clopidogrel monotherapy significantly reduced major adverse cardiovascular and cerebrovascular events compared to aspirin in high-risk post-PCI patients with no increase in bleeding. Benefit was mainly due to reduced myocardial infarction. Effects were consistent across most subgroups, especially in those with prior MI. Practice changer? Yes, especially for precision antiplatelet strategies in complex coronary artery disease. The accompanying editorial in the Lancet expressed concerns, including the fact that using the fragility index, the trial was not robust enough. The benefits were mainly after 2 years, and there's no pathophysiologic explanation. Questions lifelong antiplatelet use in stable coronary artery disease, especially in older individuals. And there was poor diversity, less than 20% women, and no multiplicity adjustment, a risk of type 1 error. They said clopidogrel may be better, but claims are fragile. What is the fragility index? Please hit pause and read this. The key takeaway is it complements p-values and confidence intervals, highlighting the robustness of trial results. Podcast brought to you by Master MedFacts at mastermedfacts.com.